Hello, my name is Zafar Naqui and I'm a consultant hand and wrist surgeon. So most people get carpal tunnel without any underlying cause. The carpal tunnel syndrome happens because the nerve that runs through the wrist has pressure upon it and it gets trapped within the carpal tunnel. So the carpal tunnel, I will demonstrate, is a tunnel which connects between the forearm and the palm of the hand. And you can see these are the carpal bones, so named because the Latin for wrist is carpus, and the carpal bones form this arch, and the arch is connected with a very strong and thick ligament, and that creates a tunnel. And through that tunnel run lots of structures, in fact 9 tendons which supply your fingers and your thumb and your nerve. And when that tunnel becomes tight, the nerve becomes pressed and you get the symptoms of pins and needles and numbness, giving you carpal tunnel syndrome. So along with the pins and needles and numbness, some people get pain. This is particularly a problem at night because of the way that we sleep. We think it's because of the way we sleep. We end up bending our hand during sleeping, and as you can imagine, that creates pressure on the tunnel, within the tunnel, and pressure on the nerve. Along with that, you may notice that you become slightly clumsy, for example with buttons or coins, that they may slip from your hand. That's another sign that the nerve may be compromised. And in some patients where carpal tunnel syndrome has gone on for some time, there may even be weakness around the thumb. If we've got any doubt, or if we want to be absolutely sure, then we can do a nerve test, and that can tell us whether the nerve is trapped. So treatment for carpal tunnel syndrome starts with conservative measures. So because most of the problems initially start at night, we can give you a splint which can keep the wrist straight. So you can imagine when you've got the bent wrist at night, if you have a splint to keep the wrist straight, that will take the pressure off the nerve, and that's really effective for quite a lot of people. If things don't settle following that, then we can consider other things, such as in some cases an injection. But ultimately, if your symptoms persist, then you may need a surgical procedure to relieve the pressure off the nerve. That's called a carpal tunnel decompression, and it's an outpatient type procedure where you would come in just for a small length of time at the hospital, and we freeze the area of the carpal tunnel, and then we can enter the carpal tunnel and take the pressure off. Your hand will be placed in a dressing and you'll be encouraged to move your fingers straight away. You can use your hand afterwards for doing simple tasks, and then your stitches are usually taken out at around 10 days time. You'll notice pretty soon after the procedure that your pins and needles and numbness should settle in the vast majority of cases. If you're experiencing these symptoms, please seek expert medical advice. We're here to help.